Have you ever wondered why chronic kidney disease affects millions of people worldwide? Welcome to the unknown realm of chronic kidney disease, often referred to as CKD. This silent ailment is a global health concern, with a prevalence that spans continents and cultures. It's a condition that is as common as it is misunderstood, silently affecting kidney function and, if left unchecked, leading to dire consequences. The importance of understanding CKD cannot be overstated. It's not just about knowing what it is, but understanding how it manifests, how it impacts lives, and most importantly, how it can be prevented and managed. Awareness, after all, is the first step towards prevention and timely intervention. We're on a journey to demystify this often overlooked condition, to bring to light the realities of living with CKD, and to educate about the power of early detection and treatment. Today we'll unravel the top 10 facts about chronic kidney disease that you should know. Starting our countdown at number 10, chronic kidney disease, or CKD, is an unseen enemy. Like a thief in the night, it often goes unnoticed, silently wreaking havoc on the body's intricate filtration system. The kidneys, working tirelessly, don't ring alarm bells until they're significantly compromised. This silent progression is what makes CKD such a formidable adversary. You could be going about your daily life feeling perfectly fine, while this unseen enemy slowly chips away at your health. It's an insidious condition that doesn't always play fair, often not showing its cards until it has advanced to a dangerous stage. Yet, it's not all doom and gloom. Knowledge is power, and understanding the subtle signs of this silent intruder can make all the difference. Catching CKD early can halt its progression, preserving your health and vitality. This is why early detection and prevention are so important. Knowledge, vigilance, and action. These are our best weapons in the fight against this unseen enemy. Fact number 9 brings us to the high-risk groups. Chronic kidney disease, or CKD, doesn't discriminate, but certain groups are more susceptible than others. Those with diabetes, you're in the spotlight, as high blood sugar levels can damage your kidneys over time. High blood pressure, another key player, puts extra strain on the kidneys, accelerating the damage. If you've ever filled out a medical history form, you know that family history matters. This is no exception. A familial pattern of kidney disease can increase your risk as well. Other factors include age, with people over 60 at a higher risk, and certain ethnic groups, such as African Americans, Hispanics, and Native Americans, who have a higher prevalence of the key risk factors like diabetes and high blood pressure. Awareness and regular checkups can be life-saving for these high-risk groups. So take note, and remember, your kidneys are counting on you. We're at number 8. The multifaceted functionality of kidneys. These pair of bean-shaped organs tucked away in our lower back are powerhouses of vital functions. They play a key role in maintaining our body's homeostasis, that is, keeping a balanced internal environment. They filter out waste and toxins from the blood, regulate the body's fluid levels, and even produce hormones that control blood pressure and stimulate the production of red blood cells. Now, imagine if these diligent workers start to falter. The waste would build up in our bodies, leading to toxicity. Unregulated fluid levels could cause swelling and high blood pressure. A lack of red blood cells could lead to anemia. The domino effect of kidney failure is indeed far-reaching and concerning. Knowing the importance of our kidneys makes us realize the severity of chronic kidney disease, or CKD. They're not just organs, they're our body's vigilant caretakers. Moving on to fact number 7, the stages of CKD. Chronic kidney disease, or CKD, is not a one-size-fits-all condition. It progresses through 5 stages, each representing a different level of kidney function. Stage 1 is the mildest form, often with few, if any, symptoms. Here, the kidneys still function normally, but signs of kidney damage may be present. Stage 2 is marked by a slight decrease in kidney function. By stage 3, the decrease in kidney function becomes more significant, and symptoms may start to appear. Stage 4 is characterized by severe reduction in kidney function, and by this point, the potential for kidney failure is quite real. Finally, we arrive at stage 5, also known as end-stage renal disease. This is when the kidneys have failed completely, and dialysis or transplantation becomes necessary. Understanding the stages of CKD aids in early detection and management. Fact number 6 unveils the preventive measures. Chronic kidney disease, a formidable adversary, can be kept at bay with a few lifestyle modifications. One of the most effective ways is through a balanced, nutrient-rich diet. Consuming foods low in sodium, potassium, and phosphorus can significantly reduce the pressure on your kidneys. Integrating regular exercise into your routine is another vital preventive measure. It doesn't have to be an intense workout regimen, just 30 minutes of moderate activity most days of the week can do wonders. It helps control blood pressure and aids in maintaining a healthy weight, two crucial factors for kidney health. Limiting alcohol, avoiding smoking, and keeping conditions like diabetes and hypertension under control are equally important. Regular checkups, too, can help detect any early signs of kidney disease, allowing for timely intervention. Remember, the best way to fight chronic kidney disease is not to let it take root in the first place. Prevention indeed is better than cure. Halfway through our countdown, fact number 5 presents the global statistics. Chronic kidney disease, or CKD, is far more common than you might think. It's a silent epidemic, affecting an estimated 1 in 10 adults worldwide. That's roughly 750 million people, a staggering figure that's more than twice the population of the United States. Within this vast number, an estimated 30 million are in the advanced stages of the disease, facing life-altering complications and the looming threat of kidney failure. The prevalence of CKD is particularly high in developing countries, where access to early detection and treatment can be limited. These figures are not just statistics. They represent real people with real lives who are grappling with this formidable health challenge. The sheer numbers underline the urgency to spread awareness. It's time we turn the tide on CKD, and it starts with understanding just how widespread this issue is. Fact number 4 explores the treatment options. With chronic kidney disease, or CKD, there's no one-size-fits-all treatment. Instead, the approach is tailored to each person's unique situation and disease stage. Medication often becomes a key player in managing CKD, helping to control high blood pressure, lower cholesterol, treat anemia, and relieve swelling. But when kidneys can no longer perform their job effectively, dialysis steps in. This process purifies the blood by doing some of the work that your kidneys used to do. There are 2 types: hemodialysis, which uses a machine to filter the blood, and peritoneal dialysis, which uses the lining of your abdomen to cleanse your blood. The most definitive solution, though, is a kidney transplant, where a healthy kidney from a donor replaces the failing one. This procedure has the potential to fully restore kidney function. While CKD is serious, it's not untreatable. Fact number 3 delves into the impact of CKD on quality of life. Chronic kidney disease, or CKD, is not just a physical health condition. Its tendrils reach into every sphere of a person's life, profoundly affecting their daily routines and emotional well-being. The need for frequent medical appointments, dietary restrictions, and medication regimes can dramatically change the landscape of one's everyday life. The emotional toll is equally significant. Feelings of uncertainty and fear, the stress of managing a chronic condition, and the strain it can put on relationships are all part of the CKD journey. It's not uncommon for individuals with CKD to experience depression or anxiety, but it's not all doom and gloom. Despite these challenges, many people with CKD find new strength and resilience, reshaping their lives around their condition and continuing to find joy, purpose, and fulfillment. Living with CKD is challenging, but support and understanding can make a difference. Approaching the end, fact number 2 highlights the importance of kidney health awareness. Our kidneys are often overshadowed by the heart, lungs, and brain when we think about vital organs, but they play a crucial role in maintaining our overall health. Chronic kidney disease, or CKD, is a silent killer, often showing no symptoms until it's too late. This is why spreading awareness about kidney health is so essential. By educating ourselves and others about the risk factors, signs, and preventive measures, we can potentially save lives. It's about understanding that regular checkups, a balanced diet, and an active lifestyle can go a long way in preserving kidney health. It's about knowing that diseases like diabetes and hypertension can lead to CKD if not managed properly. Kidney health awareness isn't just about disseminating information, it's about inspiring action. Let's not let kidney health remain in the shadows any longer. Remember, awareness can save lives. Finally, our number 1 fact: the power of early detection. Chronic kidney disease, or CKD, can be a silent invader, often showing no symptoms until it's significantly advanced. However, early detection of CKD can quite literally be a life changer. When CKD is diagnosed early, before it's had a chance to cause extensive damage, the progression of the disease can be slowed down, and in some cases, even halted. This can significantly improve the prognosis for the patient, allowing them to maintain a higher quality of life for longer. Early detection also opens up a wider range of treatment options. Patients can begin lifestyle changes, start medications, or even prepare for more involved treatments like dialysis or transplantation well in advance. In essence, catching CKD in its early stages is like finding the key to a locked door. It gives us access to the tools and time necessary to combat this disease head-on. Remember, early detection is the key. As we conclude our countdown, let's remember the importance of kidney health. We've journeyed through the unknown realms of chronic kidney disease, faced the unseen enemy, and identified the high-risk groups. We've delved into the functionality of our kidneys and traced the stages of CKD. We've talked about preventive measures, shared global statistics, and explored treatment options. The impact of CKD on the quality of life is undeniable, which underscores the importance of kidney health awareness. We cannot overemphasize the power of early detection. It's a game changer, a lifesaver. It's the difference between a life lived in the shadow of CKD and a life lived in the sunshine of health. Prevention is always better than cure. Stay informed about CKD, its risk factors, symptoms, and the best preventive measures. Knowledge is power, and in this case, it can mean a world of difference to your kidneys. Stay informed, stay healthy, and take care of your kidneys.